Hey everyone, welcome to another webinar. This is Dr. Bhavesh Patel, and I'm here to talk about testosterone therapy and how testosterone relates to the other hormones in your body. I've been doing hormone replacement therapy in men and women for the last 11 years as part of my practice with Genetics Medical Institute here in Chicago. I've treated hundreds of people, and we've gotten some great results in those people. When rebalancing the hormones, people feel better, they have more vitality, um, the body works like it should when it was younger, and the benefits for long term health are tremendous. Um, Today's webinar, we're going to cover testosterone, the other hormones that are required to be considered when you're looking at hormone replacement therapy. So I want this to be a bit of an introduction to the hormones in that regard. So testosterone is one of the main hormones. Uh, Both men and women have testosterone. Same with estrogen. Now, the importance of each of those hormones is different in men and women. Testosterone is more relevant for men. Estrogen more relevant for women, but both men and women need both hormones. Another hormone is DHEA. That's a pro hormone that turns into the others. Uh, Dihydrotestosterone or DHT is a hormone that's important for both men and women, but something that we think about more with men. And then prolactin, it's something that we don't check that often. We do check it, but not that often. But it's important if there's low testosterone and you're not sure why. So if it's someone who's younger, and I'll kind of go over those again in a bit more detail. Um, just as a reminder, the benefits of testosterone replacement therapy are that there is decreased mortality. So when they did studies of men who were on replacement therapy versus not replacement therapy, the mortality was lower in those men who were on replacement therapy. We also see a benefit with decreased cardiovascular risk or less heart disease. We also see a decreased risk of diabetes and metabolic syndrome. And part of that's just because the body's working so much better. There is more muscle mass, there's decreased body fat, you're more energetic, you're more likely to work out, stamina is better, sexual performance is better, mood is better, mental drive, ambition. All of those things are better when the hormones are balanced. We talked about this more in detail in another video, but the reasons for testosterone going down are multifactorial. Age is one of those, but environmental considerations also play in. So, especially with endocrine disrupting agents or uh, molecules and chemicals in our environment that affect our hormonal system, uh, is a big player. So let's just start with the how the body produces hormones. And I want to talk about the secretion of hormones first. One of the things to think about with hormones is they're never really at a constant level at any given time. It's not like your hormones are always 55 or 100 or whatever number you want to choose. I don't even think there's that as much variation as this much. We know that the hormones are actually released in what's called a pulsatile secretion fashion. Okay. That means the hormones go up and then they're going to come back down again. And after some interval, they're going to go up and they're going to come back down again. So whether it's an interval or a stimulus, but you get these hormonal pulsatile secretions. That's how the body naturally produces testosterone. The reason that's important is because it does impact, what you may choose as ways to replace the hormones if you decide to go that route. Um, so let's talk about the different hormones that are relevant. Um, Luteinizing hormone is a hormone that's secreted by the brain, and it's going to tell your body to essentially make more testosterone. It's going to stimulate that production. Now, I want to go over the production of testosterone in a pathway here. Your body actually starts with cholesterol as the basic building block. We've talked about this in other webinars where cholesterol is essential for the body. It's the basic building block of all your hormones, and I'm going to show you here some of those. So it's actually connected to LDL, which is your low density lipoprotein or the quote unquote bad cholesterol. In actuality, your body needs LDL to get the cholesterol to the cell. When it goes inside the cell, it turns into some different hormones. It turns into a lot of different hormones. I'm going to keep the pathway here simple. And this is generally the male synthesis pathway I'm going to focus on for this webinar. DHEA is the first hormone that's a pro hormone that turns into testosterone. It also turns into estrogen. Okay. Now it turns out that testosterone is also going to metabolize some more, and it can turn into estrogen, or it can turn into DHT or dihydrotestosterone. Now, why are these important? Well, the body, again, it works in a balance of hormones. You need all of these different hormones. The question is, in relationship to each other, how much do you need? And so there's a ratios that should be looked at. There's also absolute numbers. In general, we do want to see higher levels of DHEA in men, optimum levels of testosterone in men. You don't want the estrogen levels to be too high. This is where you can get what's called gynecomastia or breast enlargement. So that could be an issue. So we just want to keep an eye on that. Sometimes there might be some emotional issues that occur here if the estrogen levels get too high. DHT is a hormone. Now your body needs it to make muscle, but you don't want too much DHT. That's going to decrease the hair or it can cause some hair thinning. Or you might have increased prostate size. So those are the hormones we're looking at generally for men. You want to have lab values checked. I'm going to go and draw out sort of the cartoon or the short pathway for women as well. It's very similar. I'm just going to add a few more components in. We're still starting with the cholesterol and the LDL, and this happens for both men and women. But because progesterone is often measured in women and it needs replacement, I'm putting it in this diagram. But it turns into progesterone, which then turns into testosterone. Sorry, I forgot the DHEA step. So we got DHEA, then it turns to testosterone or estrogen. Now, this same conversion happens testosterone to estrogen, and then progesterone can turn into estrogen or testosterone. So essentially, what you see is these hormones can all turn into each other based on what the body needs and what the signals are. Again, remember we start with that cholesterol basic building block, and based on what you add in, it's going to change the molecule into different hormones. Going back here, one of the things that to note is with the luteinizing hormone, this is a signal from the brain to produce testosterone. And when these levels go up, it sends a signal back to luteinizing hormone that there's enough here. And then that causes the luteinizing hormone to go down. And that's called a negative feedback loop. Okay. Now, if the testosterone levels were actually low, it's going to send a signal to luteinizing hormone, and that's going to increase the production if there's not enough. So, this feedback loop is how the body has checks and balances, and it's important to understand this. Each hormone interplays with the other, the body has checks and balances with the hormone production. So, when you're adding in testosterone, your luteinizing hormone is going to go down a little bit. If you're low on testosterone, your luteinizing hormone is going to go up. And that's how the body maintains the right levels. It's got basically measurement systems. So when we're looking for labs on testosterone, uh, we're going to look at free and total testosterone. And the reason for the free and total testosterone is all the testosterone in your body, but not all of it's available to bind tissues. The free is the amount that's available for your body to sit on a receptor in the cell and cause all the beneficial aspects of testosterone to take place. So I measure both of those. We measure the DHEA. Again, that's the pro hormone. Um, and just sort of levels here for uh, total testosterones. If I'm looking to see optimum number somewhere in the 800 to 1200 range for total. Again, I like to look at the free levels, and for free, probably about 150 to 200 on the free levels of testosterone. DHEA, again, a pro hormone. That's a supplement you can take if it's low. Probably about 300 to 500 for men. This is also for men, by the way. Um, DHT should be less than 100. Again, that's the dihydrotestosterone. The estrogen. Estrogen is an interesting one. Some people say 20 to 30 is optimum. Having said that, estrogen has a number of important impacts in the body. It's important for bone development. It's important for reducing inflammation. Heart risk is lower with there's enough estrogen. Dementia is lower. Uh, the body kind of knows how much it needs. I'll sort of let this float up to 60 to 70 if there's no symptoms. And if symptoms, again, those would be feeling emotional or having enlargement of breast tissue. Otherwise, then there's a blocker for that. We'll talk about that in another video. The last important one, or not the last one, second to last, prolactin. What prolactin is it's a hormone that is secreted in the brain, and when you have too much, that's going to cause decreased testosterone. Now, when we see low testosterone in someone younger, it's really important to check the prolactin level because it could be a prolactin tumor. Now, those are benign, they're easily treated. But if there's a prolactin tumor and that's the reason for the low testosterone, that needs to be evaluated. Sometimes thyroid abnormalities, low thyroid can cause an issue with prolactin as well. And then that can cause the testosterone to be off. Uh, so, in some people, prolactin is a good test to do. The last piece is the CBC. That stands for complete blood count. And what we're looking at here is how many red blood cells are in your body. And the reason that's important is testosterone, when replaced, is going to increase the secretion of something called EPO or erythropoietin. This is something from if you remember from the 70s, athletes used to take EPO to increase the number of red cells they have in the body. It tells the bone marrow to make more red blood cells. Well, what's the problem with more red blood cells? Well, if the blood has too many red cells in there, it gets thick. And if it's thick, it's harder to get that body around it's harder to get the blood around the body. Imagine if you're trying to, push water through a garden hose or push mud through a garden hose. The thicker that blood is, the harder your heart has to work to get the blood around the body. So that's the main reason for making sure that we check the CBC. Uh, how do we check the hormone levels and how often? In my practice, obviously we do the initial draw and I check all of those numbers. And then I'll check it in 2 months and then every 3 months. Yeah, once someone's stable, maybe goes down to 2 times a year. Now, I think it's important to check all those numbers on every test. I know some practitioners are just checking the total testosterone. They may or may not check the estrogen levels or the DHT levels. Um, One thing I neglected to mention is for men, obviously, the PSA is another lab we should be checking. This stands for prostate specific antigen. This is a marker. The reason we check this number is to detect prostate cancer early if we can. Now it's prostate specific, it's not cancer specific. So sometimes you'll see the PSA go up. It's not always due to prostate cancer, but it is common in men. I mean, as men get older, the higher the risk of prostate cancer. So this is something that, um, because we're checking it early, we're checking it frequently. If it does start to go up, We're going to be catching a prostate cancer early. Um, I think that's what I'm going to cover for today's webinar. Um, this was just an introduction. I wanted the take home points to be one, that hormones are secreted in a pulsatile fashion. Uh, to me, that has an impact on the type of therapy that we're going to do, whether you're going to do continuous type therapy or something intermittent. Um, you want to be checking luteinizing hormone levels, DHEA, testosterone, estrogen, and DHT. For women, we would add in the progesterone piece. These levels here are the optimum reference ranges. They're not necessarily, you could have lower numbers that are normal. And we'll do women in another video because that's a bit more complex, and I want to just do the women hormones specifically in a webinar for that. Occasionally, you might check the prolactin, and always check the CBC and the PSA. All right, so I think I'm gonna open up to questions. Angela, can you check the chat to see if we have any questions?
We do. We have a lot of questions. The first one is, what time of day is the best time of day to get your hormones checked? And do you have to fast for the test?
Both very good questions. So I like to have these tests checked in the morning as early as possible. The hormone levels do fluctuate through the day, so whatever time you end up getting when you're doing follow-ups, probably try to be consistent. Now, having said that, there are factors that affect the hormone levels anyway, whether it's sometimes you can overtrain the day before, and that can lower your testosterone levels if you worked out too hard, or perhaps if you lifted weights, it's not a good workout, the testosterone levels could be up. So the morning matters, but what you've been doing lifestyle wise can matter too. Good sleep or bad sleep, how much stress you're having at the time that you got the blood work done, what your workouts were like. That's why having multiple measurements makes a lot of sense. Um, there's a range in which testosterone levels are good. Um, the It's when they're really outliers that something doesn't make sense. It's either too high or too low. And sometimes the best thing to do is just recheck the number and see if it's still low or it's still high, and then look into it a little bit further so you have a more accurate baseline. If it falls into the range of expectation, I'll trust that the number's pretty good. Um, and let me just say one thing that just came to mind. The right number for each person is different. So the amount of testosterone that you might require versus how much I might require, or how much Fred or Joe requires, will be different. And that's going to be based on how the testosterone attaches to receptors. If I may, I'm just going to take a minute and go back and explain this concept. Um, Testosterone has to attach to the cell, and there's a receptor attached on the cell that it's going to fit into. And this area here, how it binds, is called binding affinity. This might be getting in the weeds a little bit, but I think it's important. How well that testosterone binds to that receptor will impact how effective that testosterone is in the body. The second thing that happens is a signal has to go into the cell, and there's also variability here in the signal. So you have that point of variability, this point of variability. And finally, the activity, the anabolic activity, what your cell is going to do with the signal varies from person to person. And that's a point of variability. So these numbers are guidelines, uh, but how the patient feels is probably the most important part. So, all right. Hopefully that's useful. Next question, if we have one.
We do have a question for females. Does the menstruation cycle affect the levels when you're testing for your hormones?
It does, and I'm definitely going to cover this in detail in the webinar for women and their hormones. But hormones go up and down through the month. That's what the menstrual cycle is about, and that's going to be based on estrogen levels and progesterone levels. For women, about somewhere between day 19 and day 21 are the best times for a woman to get those two hormones checked because that's where they're both going to be on the higher side. There's times in the month where the estrogen's really high and the progesterone's really low, and vice versa. And so you can't get as good of a read at other points of the cycle. So day 19 to 21 is the best for women.
We do have another question. You mentioned that the LDL affects the hormones that are created. Is a high LDL, does that determine whether or not, say, progesterone creates more testosterone or more estrogen?
Yeah, that's a neat question. I would say that, the LDL is really just a transport protein. The reason it's important is because it does have to get the hormone from point A to point B. And this is probably why when people have too low of a cholesterol level, it might impact hormone synthesis or it might impact the benefits of the hormone. As far as the actual hormonal signaling is concerned, that's going to be based on some hormones in the brain and the pituitary gland and the hypothalamus. Those are up here, and there's something called gonadotropin releasing hormone, and then there's luteinizing hormone and follicle stimulating hormone. Those are all signals that come from the brain to tell the body to make the rest of the hormones. That's not as cholesterol dependent, but if you don't have cholesterol to take the hormone from where it is and where it needs to go, that could have an impact.
We do have one last question. When asking for these tests, do you have to have a doctor prescribe them for you, or are these, again, tests that you can order on your own?
Yeah, that's a great question. So as we've discussed in other webinars, uh, you know, getting them done by your doctor is doable. You know specifically which ones I'm asking for because I gave you the list. So you want to know what all the different tests are that are options that are at a baseline. I think some of the physicians who may not be as familiar with ordering testosterone may just order a total. They might not consider ordering a luteinizing hormone or a prolactin or an estrogen. So knowing what you want to order is important. But otherwise, as we talked about previously, it's great because we're at a time now when patients can order their own labs. Just typing into Google, uh, lab testing near me, and looking for those panels for, it'd be a male hormone panel or a female hormone panel. That should have most of these already built into those. Um, okay, I think that's what we have for questions today in terms of time. But if we have more questions, I'd encourage anyone to go to the website, BhaveshMD.com, where this webinar will be posted. And if you want to ask questions, we'll have a way for you to do that, whether it's setting an appointment to discuss topics with me, or somewhere in the comments if you have a question. We're monitoring those and we can respond to those. Thanks a lot, everybody, for joining in. Thanks, Angela, and everyone have a great day.